Hey everybody, it's Dr. Warren Kalkstein here at Kalkstein Chiropractic. Welcome back to episode 8 of the top 20 most common injuries and complaints with athletes. Here at the office, when patients come in complaining of knee pain, there's certain tissues that I want to look at first to see if they're moving well, right? And as well as to make sure that inflammation and the pain is under control. So if it's kind of your most common complaint of muscle pain where there's too much strain on the knee itself, the first thing you do is calm down the inflammation. And we've kind of talked about that in previous episodes about ways of calming inflammation down through good healthy diet, good adequate sleep, good hydration, and then the right quality movement at the right time, right? So with the knee, what controls the knee, right? You think about some of the hamstring stretches that we did in the past, as well as what's called the quadricep muscle. So the quadricep is 4 muscles that exist on the front of your thigh. They come down, they come together, they create this little thing called your patellar tendon, and that goes over the patella bone and attaches to the tibia. Okay, so this muscle, these 4 muscles that come together that help with knee extension, right, straightening out the leg, as well as controlled knee flexion, right? So this muscle, along with the hamstring, really just helps your knee be stable during gait or during your activity of running or walking. That muscle needs to be able to move well. So let's start there. Let's start with good quality movement to the quad muscle. You can grab your foam roller if you've got one at home, and you can put it under your thigh and foam roll up and down with your arms supporting your body back and forth like this. Okay? Now when I foam roll or whenever I do any soft tissue work, it might be a little bit uncomfortable, but I want to try to control it to the point where it's like some people say it's like a good hurt, right? So you don't need to smash the tissue. You don't need to hurt the tissue. You just need to loosen it up with the right amount of force that your body can handle at that time. So you'll know that. So I just use my body weight. I relax into it. I roll up and down nice and gently. And I loosen it up for about a minute like this. And I work both the inside, the middle, because there's 4 muscles and they exist in these areas. So the inside, so from here, the front, straight in the front, and then the outside. I have to turn my body for this one and rotate my hips just a little bit and run along the front side of the quad. So back and forth for about a minute. Then, this is a nice little added addition, is you're going to find a tight spot, an area where you get a little bit more tension, a little bit more feeling, say like a little bit more sensitive, and you're going to rest in that area. And then I just want to see you flex the heel towards the glute and straighten back out. Okay? I do it about 3 or 4 times in each spot. Each time I relax a little bit more into it. Good spot, a little good hurt there. And then after about 3 or 4, I go and find a new area. Stretch, bring the heel towards the butt, and straighten out. 3 times. Relaxing into it each time. You might find that the intensity increases. That's the muscle letting go a little bit, and you get more comfortable with that sensation. And I'm using my arms here to support my body so that it's not too much strain on that tissue. Okay, after you've foam rolled it out a handful of times, okay, you can do a sideline quad stretch. That's a nice way to just explore that new range of motion that you just get. One leg is straight, one leg is bent. You're gonna pull here and pull that leg back, okay? Your body's gonna rotate just a little bit, and you're gonna let that knee just drop to the floor. So I start from here. I go to this position. I let the knee drop, and you'll feel a stretch all the way through here. If you want to increase that stretch, you can take this leg, and this is called a pretzel. Pull this leg up, so your left leg is down towards the floor. You're going to grab behind the knee, pull it up gently, pull the right foot back, and get your back flat on the ground as best you can, and you're going to feel a stretch all the way through here. Okay? I'm going to show you on the left leg. Lie on my right side, pull my left leg back, Open up. I breathe in. I exhale. I want to increase it. That's a good stretch. I want to do that 3 or 4 breaths in that position, lengthening the quad, okay? So now that my quad is a little looser, I've done my foam rolling, I've done my pretzel stretch, right? Now I want to engage the quad a little bit. So first, I want to do a little bit of isometric contraction of the quad. So I'm going to grab a rolled up towel. So, laying on my back, and I want to think about taking my knee and pushing it down to the ground. If you do that, you'll feel the muscles in the knee tighten up. You're going to relax, repeat, squeeze. For 5 seconds, hold, and relax. I'm thinking about pushing my knee straight down in that position, and you'll see how the muscles tighten up and hold and relax. 5-second contractions, do it 5 times. Whoa, you're really good at that now? Here's how you step it up a little bit. After you do your 5 sets, you're gonna squeeze that muscle and push the knee down. And you remember this one from our hamstrings? As that quad is contracted, I want you to raise that quad up. And then I want you to control it down. I'm still squeezing here as hard as I can. And relax. Squeeze. All right, we got a little motion here. 10 reps. As I squeeze, I go as high as I can comfortably go. And I relax it down, okay? 10 reps on each side, getting the quads to engage with some movement, okay? Now, before I go up and show you how my favorite exercise for strengthening the quad, I want you to go through an exercise that helps strengthen the hip. Because a lot of times when I got a knee complaint, there's some weakness here in the hip. This is a simple one. You turn your toes down, and you raise your leg as high as you can comfortably go. You'll feel the muscle on the outside of your hip work, and you're going to slowly lower down. That's 3. Do 10 on each leg, okay? Strengthening up that outer hip muscle, your glute med, to help stabilize your knee, okay? So I did my 10 reps on each leg, and then I went on my side. I did 10 on each leg of those lateral motions where my toe is turning down. I'm raising up back and forth. All right, now let's go ahead and get this knee really strong. So if you've got anything you can elevate your foot up on at home, like a little bit of a raised platform, like a couch or like a lower chair where you can rest your foot on that area. I want you to take the knee that you're working on, put it back like this, right? And then I want you to control this motion as you lower down, and then driving your foot into that couch or that chair or that soft thing that you're raised your foot up onto. Say if the chair is a little firm, maybe put a towel down so your foot doesn't get aggravated in the spot. You're going to pull yourself up with that back leg. You're going to control your body going down with that back leg. You're going to pull yourself up, okay? That's a nice way to get really isolated force on that quad. And then you can go ahead and just work 10 lunges on each leg, okay? We've gone over that lunge before. I like it for a really good controlled knee flexion and extension. And if you're ready for it, if your knees are loosened up and you're engaging your quad and your hips well enough, it's a great exercise for strengthening your quad muscle after you've gotten it looser and added more stability to it, okay? So in the beginning, those mobility drills are really helpful, and then towards the end, as you're getting a little stronger, you start adding in a little bit more complex movements like that, where your rear foot is elevated and you're doing a lunge, or you're doing a lunge standing on both feet, okay? So, knee discomfort. I talked about icing it in the beginning. If you have ice packs at home and you've got a wrap, you can put ice on both the front and the back, right? If you don't have that trick where you can fill up a paper cup full of water, rip off the top and rub down those areas that are inflamed, and then getting it moving without discomfort as soon as possible. So foam rolling is a nice way to help with that. Some active range of motion, flexion and extension, like we showed you with the pretzel, with some passive stretching added. And then go into some of those contraction, so some isometric work with the quad muscle, where you're squeezing the leg down, raising it up, that straight leg raise, laying on your side, that glute med raise up and down, and then getting yourself on your feet with the rear foot elevated and doing some of those lunges. Okay, so if you have any questions or comments about the ways that we treat knee discomfort from a rehab standpoint, those are just a few of the stretches and exercises that we do. I'm happy to answer them, and again, I want to say how grateful I am that I'm able to help support the athletes of the Special Olympics and provide some videos for them to do at home, as all their events have been canceled due to COVID. So I hope you guys are enjoying these exercises. I hope the athletes out there are learning something new about how to recover from different injuries. And if you have questions or if you want me to follow up with anything, please don't hesitate to ask. I'm happy to try to answer your questions as best I can. Thanks again for watching, and we'll see you next time.